And Jim, those healthcare workers on the front lines in Pennsylvania are now bracing for the worst. We're joined this morning by Dr. Clairborne Childs, who is the lead hospitalist at Penn Presbyterian Hospital. Dr. Childs, thanks so much for joining us this morning.
Great to be with you today, Janelle.
And Doctor, we have heard from the Surgeon General and the Governor of Pennsylvania as well that these next 2 weeks will likely be very difficult, and we will likely see a surge in cases here in our region. So how are hospitals in our area bracing for this? And do you feel that we're prepared?
I do feel that we're prepared. One thing I think we have here in the Philadelphia region is we have a bit more time than I think our colleagues in other parts of the country had. I know here at Penn Medicine, something we've been doing is actually talking to the physicians in Seattle and talking to physicians in New York to really get their perspective and sort of a bit of a prep for some of the pitfalls that they face and some of the challenges that they face with providing care to patients. The numbers of cases here in the Philadelphia region as compared to New York City are much less. I think for the state of Pennsylvania, we have about 13,000 cases. For New York State, it's about 130,000 cases, so about 10 times more. So we have some time, and I think that we're using this time as carefully and as best we can to really be prepared.
And, you know, one concern that we've been hearing from healthcare workers all across the country is a lack of supplies, a lack of personal protective equipment. How has it been from your perspective here in our area?
Yeah. Here in our area, I feel that we're pretty well prepared. We're pretty well stocked. And again, this has to do with the fact that we have a bit more time. So we have time to move the right equipment, to make sure we order the correct supplies, to make sure we have the mechanical ventilators there if we need them, to make sure that we can clear off and reorganize our hospital floors to provide the right amount of ICU care if needed. So I think we're not quite feeling as much of the pinch as I think our colleagues in other parts of the country are. But again, this is mainly due to the fact that we have some time. We have a little bit more time than they did to really be prepared.
And that of course, is encouraging to hear. For you personally, going in every day, being on the front lines of all of this, what has this been like for you?
It's been surreal. You know, our training really prepares us to take care of patients. And I think, you know, any physician or any provider, any nurse, you know, we all went to medical school and nursing school, and, you know, we've all been trained to take care of patients. And I think that we'll continue to do that. That's kind of in our DNA. I think the challenge that really concerns us is if we get to a point where our patients don't have the resources, or that we don't have the resources to take care of our patients. I think that's something that our training doesn't really prepare you for, to have to ration care if it did come to that. So I think that that's sort of in the back of all of our minds, is if we get to a point that we're not able to provide the best care that we would normally provide. I think that that's the fear that keeps us up at night, is worrying that, you know, if we get to this surge, we'll be able to meet the needs of our patients. And so again, I think we're doing the best we can to be prepared. You know, we're all pretty good thinkers. We think well on our feet. We're pretty nimble. And so I think that that's where we really focused, is getting a good plan together should the surge happen.
Now, one positive thing that has come out of all of this is that we've really seen the community, the local community, stepping up and supporting healthcare workers like yourself on the front lines, whether it be with meals or creating. Yesterday, we spoke with a man who's making plastic face shields for healthcare employees. What has that been like for you to get that support of so many people?
It's been great. You know, we're here in West Philadelphia, and just the support we've received from the community has been awesome. There have been free meals for our nurses, for our residents who are in training. I know a clothing company recently came by and gave some clothing donations to the workers who were at our drive-through COVID-19 testing area over on Market Street. It's just been awesome. You know, we didn't get into this business to get free stuff. But, you know, to know that we have the support of our community and know that, you know, they have our backs and that they're there to cheer us on, I think that that's been one of the most heartwarming things about this whole experience.
Dr. Clairborne Childs, thank you so much for taking time to speak with us this morning, and best of luck to you, and stay safe to you and all of your colleagues. Thank you.
Great. Thank you, Janelle.